Hello, I'm Dr. Dempsey, and this is the Allied Trades Assistance Program. Today we're going to offer an educational slide on the use of benzodiazepines. What is a benzodiazepine? Benzodiazepine is Xanax or Klonopin or Ativan or other medications that are like that. Typically, Ativan and Klonopin and Xanax are used for folks who have anxiety disorders. Oftentimes, general practitioners will prescribe Ativan or Xanax as a first-line medication for folks who are coming in with things like panic disorder or maybe complicated bereavement from when somebody in their family passed away. That in and of itself is not problematic. In a couple of minutes we'll talk about why it would be problematic to continue to get your medication from your general practitioner. Benzodiazepines are very strong medications, even though the milligrams of them are very different than other medications. And oftentimes I'll talk to patients who I see who are confused by milligrams. For example, you can take a 500 milligram Tylenol, and that will not be as powerful as a 1 milligram Xanax or Ativan. And anybody who has ever taken an Ativan or Xanax will definitely be able to tell you that. Ativan and Xanax are created to help reduce the activity that's going on in your brain. Basically, Ativan and Xanax were created as seizure medications. But one of the side effects of that medication is it reduces anxiety. Now, the thing about benzodiazepines is they create a very intense physical dependence. And more importantly for this topic, because they are so effective at decreasing the arousal of the brain, they also create an extreme psychological dependence. Most people do not know, including general practitioners, that Xanax, Valium, Klonopin, and other benzodiazepines are only supposed to be prescribed for no more than up to 8 weeks. Anything beyond 8 weeks is usually for some sleep disorder that somebody may have or a seizure disorder. If it's being used to treat an anxiety disorder, often what happens is the anxiety disorder gets worse because the body tolerates a benzodiazepine relatively rapidly. And because it tolerates it, because you need more of that medication to have the same effect that it had with you before, you wind up having to take more and more and more of those medications. At the point that you are taking more of those benzos than what you thought you would be taking, your general practitioner becomes concerned and often stops that medication. And then you're left with a problem because the withdrawal from benzodiazepines is extremely uncomfortable, extremely anxiety provoking, and can wind up fatal. Because it is an anti-seizure medication, you can have a seizure within a couple weeks of your removal from that benzodiazepine, and you can die coming off of it. So it's important for you to know if you have an abuse of the benzodiazepines, such as the Xanax or the Valium or the Klonopin, and you're finding that you are not able to stop, it is important that you seek treatment for that. You can seek treatment with your general practitioner, but they will probably refer you to a program that will be able to help reduce your physical dependence. You can also seek treatment from a psychiatrist. And it probably is important if you have an anxiety disorder that you seek treatment through a psychiatrist and a psychologist, because they can help treat that anxiety problem in and of itself. And you will not need medication, or you will get a medication that will not have the significant side effects that the benzodiazepines have. The other issue with Xanax and Valium is that when you use that in conjunction with other medications or alcohol, those other medications will create what is called a synergistic effect with the Xanax. That means it makes the Xanax and the Valium and the Klonopin much, much stronger than it would be by itself. In fact, people often black out when they take a Xanax or a Valium when they're drinking. And in that blackout, I've seen through the Department of Corrections a number of inmates incarcerated because of extremely violent offenses that they created when they were under the influence of alcohol and Xanax. Now, the part of that gets confusing is even though they are prescribed, you have to take them as they are prescribed. If you do not take them as they are prescribed, then you're going to have a problem. Also, as discussed in other slides, you should never take somebody else's medication. That Taking somebody else's medication is not only problematic medically, it also is illegal. If you find you are having issues where you need help coming off of Klonopin or Xanax or Valium or another benzodiazepine or any other substance, you can contact the staff at the Allied Trades Assistance Program. And their number is 1-800-258-6376 or 215-677-8820.